first test that we're doing is the Fader test, also known as the flexion, adduction, and internal rotation test. So what we're going to do is we're going to have them lay flat on their back just like this. We'll flex their hip and knee at 90 degrees and then adduct their leg while externally rotating. A positive test would be reproduction of the pain in the front of the hip or groin. And that positive test may indicate a femoral acetabular impingement or hip or labral tear. The name of this test is the hip scouring test. So the patient will be lying flat on their back. And then we'll bring up their knee into 90 degrees of flexion. And then we're going to put some force down into the femur like this. While applying pressure through the femur, you're going to move the hip through different ranges of motion, so internal and external rotation. A positive test would include pain, clicking, catching, grinding. Pretty much just a reproduction of the patient's symptoms. A positive test may indicate a hip or labral tear, osteoarthritis, or other hip joint injuries. The name of this test is the Trendelenburg test. So you'll have the patient stand on one leg while I observe the position of the pelvis. I'll repeat the test also on the opposite side. So what we're looking for here in a positive test is if the pelvis drops on the side of the lifted leg. Positive test would indicate weakness of the glutes, the gluteus medius, or other hip abductor muscles. So the name of this test is the femoral nerve traction test. So you're going to have the patient lay on their side with their leg that's on the table will be bent at 90 degrees. You'll bring their other leg up and bring it into slight hip extension while then flexing the knee. Positive test would cause pain or numbness, also light tingling. Positive test may indicate a femoral nerve irritation or upper lumbar nerve root involvement. The name of this test is the straight leg raise test. So you'll have the patient lying on their back with their knees straight. We'll then slowly raise their leg while asking if they have any pain, and right when they start to feel the pain, that's where you'll stop, and then you'll go down just a little bit more until it doesn't hurt again. And then from here, you're going to dorsiflex their foot and have them bring their neck up. And if that reproduces the pain in the leg, that would indicate a positive test. So a positive test may indicate lumbar disc involvement, lumbar radiculopathy, or a sciatic nerve irritation. All right, so the name of this test is the slump test. So you'll have the patient sitting upright and they'll slump their back, and then they're going to extend their knee, and then from there you're going to dorsiflex their foot. So a positive test would do a reproduction of the radiating pain, numbness, or tingling. And a positive test may indicate neural tension or lumbar root irritation. The name of this test is the Kerning-Brzezinski test. So you'll have the patient lying flat on their back with their hands behind their head. They'll then flex their head up and then bring their leg up until they feel pain. And then from there, they're going to let their knee flex down to 90 degrees and then back up. So a positive test would be pain or resistance with the knee extending. And then the test is involuntary flexion of the hips and knees when the neck is flexed. A positive test may indicate meningeal irritation. The name of this test is the sacroiliac compressions test, or the SI compression test. So you'll have them lay on their side just like this with their knees flexed between 40 to 60 degrees. And then from here, You'll apply pressure and compress the sacroiliac joint. A positive test would be reproduction of the patient's sacroiliac joint pain, and this could indicate a sacroiliac joint dysfunction or a sacroiliac sprain. So the name of this test is the sacroiliac distraction test. So you'll have them lie on their stomach just like so, and then you'll place their hand right on the anterior superior iliac spine, and then from there you're going to bring their knee into 90 degrees flexion while bringing it towards you just like this. A positive test would be reproduction of the sacroiliac joint pain. Positive test would indicate sacroiliac joint dysfunction. This is the sacroiliac dysfunction screen. So first you're just going to have the patient sitting just upright like this, and you're going to find the iliac crest on each side, and then you're going to compare the heights on each of them and just make sure they're both the same height. And then from there you're going to find the anterior superior iliac spine, and from there you're going to have the patient lift knee on one side, and you're going to feel the rotation. You're going to have them do it on the other side, and you'll compare them. So a positive test would be indicated by having uneven hip height or abnormal movements during one side of the hip flexion. A positive test may indicate sacroiliac joint dysfunction, pelvic rotation, or another pelvic alignment problem that may contribute to lower back or SI joint pain. So the name of this test is the stork test. So you'll have them stand on one leg and then gently extend their back while doing it. A positive test would be localized pain on the standing side, so you want to test both sides while doing this. And then a positive test would indicate spondylosis. Alright, the name of this test is the Hoover test, so you'll just have them lay on their back just like this. And you're going to lift both of their legs up just like this. And then you'll have them lift up one of their legs off your hand, and then they can bring it back down. And then do it for the other one as well. What you're looking for is downward pressure in the hand that's still holding onto the leg. Positive test is little to no downward pressure under the opposite heel. And a positive test may indicate non-organic weakness or symptom exaggeration. So the name of this test is the lateral rib compression test. So you'll just have them sitting upright just like this, and then you'll gently put your hands on each end of the rib cage and gently apply pressure inwards. A positive test is localized pain in the ribs or crepitus. A positive test may indicate a rib fracture. So the name of this test is the anterior-posterior rib compression test. So you'll just have them sitting upright just like so, and then you'll place one hand on their mid-back and then another one right in the front, and you'll apply pressure to the front and back. Positive test would be localized pain in the ribs or crepitus, and a positive test would indicate a rib fracture. Okay, the name of this test is the brachial plexus compression test. So you're just going to have them sit upright just like so, and you're going to stabilize the head while then applying pressure right above the clavicle where the brachial plexus is, while asking if there is any symptoms of pain being reproduced. A positive test would be having pain, numbness, tingling, or weakness in the arm, and the positive test would indicate a brachial plexus irritation or injury of some kind. All right, the name of this test is the Adson's test. So we'll just have them start by sitting in this position just like this, and then You'll find their radial pulse. Once you have found it, you'll bring their arm back just like this. Have them take a deep breath while looking towards the affected side. Positive test would be reproduction of the symptoms with decreased pulse, and then this could indicate a thoracic outlet syndrome involving compression of the brachial plexus or subclavian artery.